Good evening all attendees and panelist team. आज के हमारी फ्री वेबिनार सीरीज नंबर 6 में आपका न्यू इंडियन एजुकेशन रिसर्च सोसाइटी संचालित श्री सेंट्रल मेमोरियल नर्सिंग कॉलेज के मैनेजमेंट टीम का एक प्रतिनिधि होने के तौर पर आप सबका हार्दिक स्वागत करता हूं। आज का जो सब्जेक्ट टॉपिक्स है हमारा नर्सिंग मैनेजमेंट इन कोविड-19, जिसकी रिसोर्स पर्सन है मिस्टर अलेक्जेंडर सी, जो एक नर्सिंग ऑफिसर है ESC हैदराबाद में। आज वो उनके एक्सपीरियंस हमारे साथ शेयर करेंगे। आगे का परिचय डॉक्टर मेहुल कॉन्ट्रैक्टर और हमारी टीम के और एक सदस्य मिस्टर दिव्येश पटेल देंगे।
Thank you, sir. Good evening, everyone. I warmly welcome all the nursing students, all the faculty members, BSc, MSc, faculties, and students as well, and those viewers all around the globe who is listening to us and watching us on live Facebook. Well, regarding the topic, sir has explained the nursing perspective and the nursing management in COVID-19. We all are aware that India is suffering from COVID-19 disease currently. Okay, yesterday's webinar was all about the physiotherapy perspective. Now today we thought that let's go for the nursing perspective also, because what I believe is genuinely, rather than the physiotherapy who deals with the COVID-19 patient, more than that, 10 times, I would rather say 20 times, the nursing management is going on with that COVID-19 patient thoroughly. So physiotherapy play a role, definitely, but the nursing play a major role, I would rather say. Okay, so in that context, yesterday we had a webinar on physiotherapy perspective. Then I thought not only physiotherapy perspective, we should know about the nursing perspective also. So here we are with the webinar with the topic of nursing perspective, nursing management in COVID-19. The speaker, Mr. Alexander, a long back, he was an academician. Very few people might be knowing that he was an academician. He started his journey in Abu Road, USB Medical College. And then, he belongs to South India. Then he went back home. Then he did, work in the hospital, many of the hospital. And he's now very sound in clinical part. And currently he is a government employee and working in ESI hospital in Hyderabad. And he is having a very huge and vast experience. He has completed his MSc and he is having very huge experience clinical side, and he might be having so many cases of COVID-19 positive in his department also. So he is going to share a lot of knowledge. So my request to all the students, please ensure that get maximum out of the resource person. Put your queries, send all the queries through inbox, ask as many as questions, and then get maximum out of this video. Now, Mr. Davis sir will introduce Mr. Alexander sir.
Hello, good evening all of you, all the nursing staff and the students. I would like to welcome our today's guest speaker, Mr. Alexander. He is working presently as a nursing officer at ESIC Hospital, Hyderabad. He has completed his Masters in the Community Health Nursing from NTR University, Andhra Pradesh. Sir has previously worked as a lecturer and the assistant professor in the various nursing colleges across the India. Sir has published number of articles in national and international journals and involved in the various nursing researches. Now I warmly welcome you, sir, and now I take over to the Alexander, sir. Thank you.
Thank you, sir. Thank you all of you, and good evening, one and all. First of all, I would like to say thank you to the VN Patel Medical Campus Management, Dr. Mehul sir and Divyesh sir and CEO of the VN Patel College. And it's a very good opportunity for me to express my views on COVID-19 in a nursing perspective. So I hope you are all ready to get some knowledge from me, and I am going to give you a very brief and short and sweet information about the nursing management in COVID-19. Once again, good evening all. Myself, I'm Alexander PC, currently working as a ESIC as a nursing officer. Today, why we are going to discuss about this coronavirus? Because if you see these statistics around the world, so as of today, we have observed 54 lakhs confirmed positive cases around the world, and if you see the deaths, 3 lakhs and more deaths are there, and it is around spreading around the world in a 216 countries. So that's why it is confirmed as a pandemic. And coming to the
Alexa, just a moment. Your slide is not shared and the viewers are not able to see.
okay,
Can you please share the slide?
yes sir, sure.
Yeah. Yes,
Sir, is it
it is
okay?
now. Is it okay?
Yes, sir. Yes, sir.
Okay, sir.
Sir.
Thank you. Sorry for the interruption. And once again, good evening, one and all. So today we are going to discuss about the nursing management in COVID-19. So why we are going to discuss about this nursing management or about COVID-19? If you see the current situation in the world, the world is severely affected by this coronavirus. Why? If you see these statistics around the world, there are 54 confirmed COVID-19 cases are there. And if you see the death rate also, above 3 lakhs cases are died already. And, and it is around 216 countries are affected with this coronavirus. And coming to the statistics of the India, as of today, up to the afternoon session, by more than 1.5 lakh cases confirmed as a positive, and out of that 84 active cases are there, and in that above 4,000 cases we have seen died. So that's why we have to think about it, and we need to learn more about this disease condition, so because it is changing our day-to-day lives. And if you see, uh, currently not only India, entire world is suffering with this deadly disease. So I have never seen this type of situation in my entire 30 years of life, and I never imagined a situation like this it will come in my lifetime. So that's why we have to concentrate on this disease, and we have to take some precautions, and we need to learn some knowledge, and we need to implement in this day-to-day life and in our practice, professional and personal lives also. So today my topic is nursing management. So all the healthcare workers are considered as a frontline warriors, but out of that, nurses are more important. If you see, somebody coined like this: nurses are the unsung heroes of the COVID-19 response. The invaluable role they have played is testimony of their sacrifice, courage, and commitment to a healthier and safer world. As a frontline workers in the battle against coronavirus continue to put their lives at risk, many have fallen victims to the infection. So if you see, I'm just telling about the nurses only, because anywhere in the world, if you found a hospital without a doctor, without a technician, without a pharmacist, without a laboratory technician also, but you cannot imagine a hospital or a clinic without a nurse, because nurses are the backbones of the total healthcare system. So that's why, mm, I, if you see any health team, 50% of the staffs will be nurses. So that's why nurses are considered as the backbone of the system, and any disease, whether it is a MARS, SARS, COVID, or swine flu. So nurses will play a vital role in the curing or preventing or treating the any type of disease. So whereas coming to the coronavirus situation, healthcare workers also getting infected. I don't know whether it is a fault of the system or healthcare system or by the personal problem. So if you see in India, coronavirus has infected around 548 health workers around the India. Out of that, 274 nurses have been tested positive so far up to the end of the April. So this is the worst thing because when we are ready to do something to the society, so we are putting our lives in a danger. So out of 548 members positive, 274 were nurses. So and this is as per the records. I think there were many unnoticed or unregistered cases also will be there as per my knowledge. And if you see that Delhi has the highest number of nurses testing positive with 35 infected only in Delhi, and Mumbai follows with the 27 nurses affected, and at last Kerala is only registered one case. So in this PPT today, I am going to point out the following topics. A nurse or a healthcare worker must have knowledge on following topics to treat or care the COVID-19 patients. First of all, one must have an idea about the epidemiology of the particular disease condition. Like today, we are going to deal about COVID, so coronavirus. So everyone must have a knowledge about the disease condition. So I think if you ask anybody now, any illiterate or a small children also, they are having awareness. So that's why I'm going to give you a brief introduction about the epidemiology, and then we will go and concentrate on the screening, triaging, and the initial approach. Screening, triaging is a very important thing. So one must have an idea about the how to screen the condition, how to approach a patient initially, the first and foremost, and how to triage. Triaging means separation of a patients from a COVID to non-COVID. Okay. So we need to triage the patients in the initial stage only at the time of the entrance of the hospital, any healthcare sector. When the person is entering into the hospital, we have to triage, means separate the patients from a COVID to non-COVID. How we will triage means we have to ask. There are some certain guidelines as per the WHO guidelines and CDC guidelines are there. If you ask or if you observe their signs and symptoms like a fever, a cough, and any travel history or myalgia, diarrhea, or like that, we have some checklist. I will show you at the end of the PPT. So by that checklist, we have to ask the patient, and we need to observe the signs. Based on the signs and symptoms, we will triage the patients. This is called screening, triaging, and initial approach. And next, coming to the infection, prevention, and control. So here, infection, prevention, control. So this is the very important thing. So in this point, we have to concentrate all the healthcare workers mainly. So because this is a highly infectious, contagious disease. So if you are not following proper guidelines, or if you are not proper infection control protocols, then you will be in a trouble. So that's why we have to focus on infection prevention and control practices, like following some standard protocols, and like wearing PPE, complete PPE, personal protective equipments. Okay, and following some basic things like standard protocols, like following hand washing, hand hygiene, and respiratory hygiene. And so these are the points. Later I will discuss in a detailed way. And coming to the fourth point, monitoring the patient. As a healthcare team member, especially when you are a nurse, you have to have a good sound knowledge on monitoring the patient. Monitoring patient is very, very important and a vital thing in your day-to-day clinical practice. How you need to monitor, what are the things you have to concentrate when you are treating a COVID-19 patient. So you must have some uh, idea about the disease, and you must have some important points in your mind that we need to concentrate on the ABCs like airway, breathing, circulations, and we have to check the patient's vitals each hourly or second hourly basis, and we have to know the ICU protocols or isolation protocols. Okay, so those are all the things we have to monitor the patient hourly basis, and we need to record it and we need to report it immediately. So what are all the things we will monitor? We will see in the next slides. And coming to the fifth point, respiratory specimen collection and procedure. Everybody should have knowledge on how to collect the samples and how to send it to the laboratory for getting tested. So mainly we'll take three types of samples like a nasopharyngeal swab and oropharyngeal swabs and blood samples also. So main thing, nasopharyngeal swab is giving accurate results than the oropharyngeal swabs. So next thing, oxygen therapy. So if you observe this disease deeply, coronavirus is nothing but it is a world one only. So actually in this disease, what is happening? It is causing a ARDS, acute respiratory distress syndrome. So in this, what the patient needs means main oxygen support. So we have to concentrate on this oxygen support also. As a nurse, you must have some idea about the oxygen therapy, which type of oxygen you are going to provide, how much you are going to provide, and how to taper it. Oxygen therapy, you have different types, like are you going to provide this oxygen with the free flow oxygen or with the nasal pros, or next coming to the face mask, or you are going to provide oxygen with the high flow concentrated um, oxygen machine, or you are going to give a NIV, non-invasive ventilation. Non-invasive ventilation means you are not going to insert any pipe or tube into the body. So this is non-invasive procedure. Uh, uh, Non-invasive by through giving CPAP like or BiPAP, or you are going to give oxygen through the intubation like a endotracheal tube, ET tube insertion, and you are giving oxygen through the mechanical ventilation, or final step you are going to give oxygen through the tracheostomy, tracheal intubation. So these are the types are there in the oxygen therapy. So you have to uh, have some knowledge on the oxygen therapy also. And next coming to the antimicrobial therapy. Antimicrobial therapy. In this antimicrobial therapy, we need to have some idea about the what are all the medications we are giving. As of now, there is no treatment. There is no exact medication for this deadly disease, but we are giving a supportive therapies, means palliative treatment, symptomatic treatment we are giving. In this, we are using some antibiotics to kill the bacteria. Suppose yeah, all these COVID cases are having pneumonia symptoms, so we'll give some antibiotics to treat that, and some types of antivirals also, oseltamivir like that. So we need to have some idea about the antimicrobial therapies. And coming to the last point, uh, as a nurse, you must have knowledge on the how to manage the ARDS, acute respiratory distress syndrome, and you need to have some idea about sepsis and shock and pain. The pain is nothing but it's not as physiological pain. This is a psychological pain, mental pain, trauma. So one must have idea about all these points. So now I'm going to give you a brief idea about all these points. So kindly cooperate with me. And first, we are going first. What is coronavirus? So everybody knows coronavirus is a virus. It is coming from a large family of virus. which may cause illness in animals or humans. In humans, several coronavirus are known to cause respiratory infections ranging from the common cold to more severe diseases such as Middle East Respiratory Syndrome MERS and severe acute respiratory syndrome SARS. So already coronavirus is having exist in this world previously before 2020 only, but now this trends has changed, and now it is causing a corona COVID-19. So most recently discovered coronavirus causes coronavirus COVID-19. So what is COVID-19? COVID-19 is the infectious disease caused by the most recently discovered coronavirus. So it is a newly discovered coronavirus. So already we have some old type of coronavirus like MERS and SARS. This is newly uh, identified a disease that is called COVID-19. This new virus and diseases are unknown before the outbreak began in Wuhan, China in December 2019. So before 2019, we don't know about this coronavirus. So COVID-19 is now a pandemic affecting many countries globally. As you know already, I have already explained in the very first slide. So it is already spread in the 216 countries around the world. That's why it is considered as a pandemic. So at a time, it is uh, spreading all over the world. That's why it is considered as a pandemic. And if you see the incubation period of this coronavirus, incubation period uh, for COVID-19 is thought to extend to 14 days with a median time of 4 to 5 days from exposure to symptoms onset. So usually you can say the incubation period of coronavirus is 14 days. But on an average, if you see 4 to 5 days from exposure to symptoms onset. In one study, reported that 97.5% of persons with COVID-19 who develop symptoms will do so within 11.5 days of SARS-CoV-2 infection. On an average, you can say incubation period of 14 days. That is okay. And coming to the spread, transmission, how does COVID-19 spreads? I think we know very well about this thing. We have a very much idea and knowledge about this spreading. Nowadays, everywhere they are creating awareness in the mobile phones and the televisions, in the print media, mass media, social media. We are getting very good information about this spread and prevention, all those things. I just give you a brief idea how it will spread, how we will get this coronavirus. People can catch COVID-19 from others who have the virus. So we will get this virus from a person who is infected, from who is infected already. So how this is spreading? The disease spreads primarily from person to person. So from person to person, how it will spread? Through a small droplets from the nose or mouth, which are expelled when a person with COVID-19 coughs, sneezes, or speaks. Okay, so then how it spreads? When an infected person coughs or sneezes or speaks, then the droplets will come out, and these droplets will enter in the surroundings of that patient. Okay, these droplets are relatively heavy, do not travel far, and quickly sink onto the ground. So when imagine if I am a COVID-19 positive case, if I cough, then or sneezes or speaks, then droplets will come from my mouth or my nose to the enter into the surrounding environment. Okay, and these will travel in the air for at least 1 meter distance, or it will be settled down on the surfaces, suppose on the chairs, tables, or in computer, laptops, doorknobs, all those things. Okay, when you touch those surfaces, you will get you will get that infection on your hands. Then when you touch that hand, that hand onto nose, mouth, or eyes, then automatically these virus will enter into your body. Okay, people can catch COVID-19 if they breathe in these droplets from a person infected with the virus. This is why it is important to stay at least 1 meter away from the others. So we know very well already everybody is telling maintain social distancing, social distancing. Why we need to maintain this social distance? At least 1 meter means I have already mentioned that point. These droplets are heavy. I mean, these COVID-19 droplets are heavy. So that's why these cannot travel more than 1 meter. I mean, 3 feet. So that's why we have to maintain some social distancing. So at least 1 meter or 2 meter distance if you maintain from a person to person, then automatically you are not in a chance to get this infection. Suppose if that person is already positive, if he speaks, coughs, or sneezes, or then already droplets are came out and present on the surfaces. If you touch those surfaces, then you will get that infection automatically. So droplets can land on objects surface around the person, such as tables, doorknobs, and handrails. People can become infected by touching these objects or surfaces, then touching their eyes, nose, or mouth. I already told this thing. Now, this is why it is important to wash your hands regularly with soap and water or clean with alcohol-based hand rub. So this is very important. After touching doorknobs, chairs, tables, and high surface areas, suppose if you are working in hospital areas, when you are touching the patient, patient surfaces, linens, or side rails, or anything in the hospital area or in a public areas. So if you are touching and without cleaning your hands, then you are touching your eyes, nose, mouth, then easily you can transmit this disease. So that's why what we need to do for preventing this, you need to do hand wash regularly. So whether it is with a soap and water or with a alcohol based hand rub. And coming to the symptoms of COVID-19, what are all the clinical manifestations you will see in the COVID-19? If you divide this thing in three types, like most common, severe, or critical, or less common symptoms. So COVID-19 affects different people in different ways. Most infected people will develop mild to moderate illness and recover without hospitalization. So most of the people will develop mild to moderate illness only. So there is no need to panic if you get infected with this COVID-19 also. If you are a young and a healthy person, uh, there is no need to panic about this thing, because you will have a sufficient immunity power to treat to kill this virus. And if you have some idea about this thing, how to prevent, how to control this thing, like following some isolation protocols, so then you can easily prevent. So that's why mild and moderate illness, you can easily get recovered from this thing without hospitalization. If you see the symptoms, most commonly, and 80%, above 80% of the COVID positive cases, you will see the symptoms like fever, dry cough, and tiredness. In 80, more than 80% of cases, you can see the uh, persons with COVID-19 positive, you will observe the symptoms like fever, dry cough, and tiredness. And in some cases, very less common symptoms, but they will also get these positive symptoms, positive cases. So less common symptoms are like aches, I mean pains, body pains and all, then sore throat, diarrhea, conjunctivitis, headache, loss of taste or smell, and a rash on skin, or a discoloration of fingers or toes. So these are the very less common symptoms, but with these symptoms also cases are getting positive nowadays. Okay, then coming to the serious symptoms, we have seen less common and more common symptoms, and coming to the serious symptoms, why we have to stress on these points? If you found a person with these serious symptoms, immediately you need to get hospitalized. So what are those serious symptoms? If you see the first one, difficulty in breathing, shortness of breath, SOB. So dyspnea. So when a person is feeling difficulty in breathing or shortness of breath, so immediately you have to seek medical attention. And next symptom, chest pain or pressure. And next, loss of speech or movement. So these are the classical serious symptoms to identify a corona positive case. So when you feel these positive symptoms, serious symptoms, you can immediately join hospital. Then you can get that tested. You can get it tested. Okay. Then seek immediate medical attention if you have serious symptoms. Always call before visiting your doctor or health facility. People with mild symptoms who are otherwise healthy should manage their symptoms at home. I already mentioned this. And uh, apart from these serious, less common and more common symptoms, nowadays we are getting tested positive. Some of the cases with asymptomatic, without any symptoms, people are getting positive COVID-19. People who are working in the hospitals, people who are working in outside, like in public sector, policemen or sanitation workers, get tested positive without any symptoms. So we need to concentrate on the asymptomatic things also. Okay. I think till now, hope you are clear with these things. Next, if you see the clinical course, we can divide this disease into three categories. Like how we will divide this disease means based on the illness severity, disease severity. So mild to moderate, you will see 81%. I told you in the symptoms also, 81% of the cases are coming under mild to moderate, mild symptoms up to mild pneumonia. That's it. We can treat it. If you are healthy, you can treat it with at home only. Okay, if you are maintaining strict quarantine rules, if you are isolating from others, then automatically it will be cured. That is coming under mild to moderate severity. And next, coming to the second category of illness, severe. In this, you can see you can found some symptoms like dyspnea, hypoxia. Hypoxia is a loss of oxygen in the cells, the tissues. So hypoxia and dyspnea, more than 50% lung involvement on imaging. Like when you see radiographical studies, lung involvement, you can see some consolidations you will see in the severe type of illness. So it is considering about 14% of cases are coming under severe illness. Okay. Next, third category, only 5%. These people are coming under critical, 5% critical. So here what is happening? Respiratory failure, shock, or multi-organ system dysfunction. So only these 5% of cases are having chances to get worsened. So remaining mild to moderate or severe cases we can treat very well, and these people also come out very well. If you have a good protocols and if you follow good quarantine techniques and if you get a proper treatment on time. So but coming to the critical cases and people with more age group, like risk factors are very high for the age group above 80 85 years or above 65 years people coming under these critical cases with all the comorbidities. People, it doesn't mean if you are a corona positive case you will get died. If you are having a other comorbidities like uh, diabetes and hypertension or cardiovascular diseases or some renal diseases, then only you are coming under this critical stage. Okay. Next, coming to the risk factors for severe illness. So what are the risk factors? So for getting this disease, age is the strong risk factor for severe illness. I told you already, age is a very risk factor for getting a severe illness and complications and death. The, the case fatality rate was highest among the older persons, the age group above 80%, above 80 years. So, so fatality rate is like mortality rate. If you take 100%, so in that only so like within a 28 days of time, if you see the mortality rate, that is coming at the fatality rate and the death rate. So on old age people above 80 years people, we will see the highest number of cases regarding deaths. And coming to the age group 70 to 79 years, only 14.8% cases are registering deaths. And coming to the 60 to 69 years age group, only 8% you can see the fatality rate. And coming to the 50 to 59, 3.6, 40 to 49 years age group, only 1.3% fatality rate. And less than 40 years, you can see the fatality rate under less than 1%, less than 0.5, 0.4% of cases only getting death less than 40 years of age group. So these are the some of the risk factors. If you see the risk factors, age is the main risk factor. And coming to the testing, how we need to get the diagnose with this coronavirus. What are the things we have to see and how to get tested? What it is happening in testing. So how to diagnosis of COVID-19 requires detection of SARS-CoV-2 RNA. So what we are doing here, we are detecting the SARS-CoV-2 RNA, means COVID-19 RNA. So how? By reverse transcription polymerase chain reaction, means Rtpcr test. So we are doing the Rtpcr test. For this Rtpcr test, what we are doing, we are taking samples. I told you in the earlier, we are taking the nasopharyngeal sample and oropharyngeal samples to detect the COVID-19 by Rtpcr test. Rtpcr means reverse transcription polymerase chain reaction test. So that is the thing. And detection of SARS-CoV-2 viral RNA is better in nasopharynx samples compared to the throat samples. Or compared to the oropharyngeal sample, nasopharyngeal samples are having good results. It has also been detected in stools and blood. I told you, we can take the blood sample also for testing this. And recently it is discovered corona is present in GI tract also. So that's why you can take the stool also. And I have read somewhere in the recent articles, so by farting also you can spread the coronavirus. So I think this is true. And detection of SARS-CoV-2 RNA in blood may be marker of severe illness. If you found a blood sample is giving a positive result, it means already viral load is very high. So it is coming under severe illness category. So these are the things coming under diagnosis of viral testing. So what are all the another types of tests are there? We will see. Coming to the radiographic test. So by X-ray or CT, how can we identify this COVID? Means yes, it is how chest radiographs of patient with COVID-19 typically typically demonstrate bilateral airspace consolidation. If you see a chest X-ray of a suspected case, in that suspected case, if you found a chest X-ray with bilateral airspace consolidation, it means there is a chance of getting positive COVID. So it is one of the marker in radiographic findings. In X-ray, bilateral airspace consolidation. I think one must understand, all nurses, whenever you are receiving a patient from a casualty or from any other areas, we have to remember one thing. Always that patient should undergo for a chest X-ray, because chest X-ray is giving you clear indication that if the patient is having bilateral airspace consolidation, then you can suspect this patient might be having some coronavirus symptoms. So for asymptomatic or symptomatic cases also, we need to get it tested by radiographic things. Okay, and what is the next thing? In chest CT image from a patient with COVID-19 typically demonstrate bilateral peripheral ground glass opacities. If you see the CT images of the positive case, you can found bilateral peripheral ground glass opacities. So these are the radiographic findings you will see. And coming to the health work rights, roles and responsibilities. As a nurse, when you are working in hospital setup, you must have some idea about what is your rights and what is your roles, what are the responsibilities you need to fulfill. When you are going to do fulfill your responsibilities and roles, you must know your rights, because most of the nursing fraternity people forgot about the rights, forgot about to ask their rights. Okay, that's why these 270 cases got positive in India, and around the world, if you see, there are thousands of nurses got positive, and there are number of deaths also recorded, because these nursing fraternity is always having some inferiority complex. So they don't ask anything about the management. So we are ready to serve anytime, anywhere in the world. But whenever we are working, whenever we are dealing with these deadly diseases, we need to understand some rights. We need to ask for those rights. First, you need to learn. You need to raise your voice to uh, get those rights, and at the same time, you need to fulfill your roles and responsibilities also. I just give you brief introduction, brief idea about those rights, responsibilities, and roles as per the WHO norms. I am not giving these rights and roles as per my knowledge. This is by the guidelines framed by the WHO, World Health Organization. So that health worker rights include the expectation that employer and manager in health facilities assume overall responsibility to ensure that all necessary preventive and protective measures are taken to minimize occupational safety and health risks. So, assume overall responsibility to ensure that all necessary preventive and protective measures. So what management has to do, it has to provide, it has to look after the welfare of the staffs. So all for all the healthcare workers, starting from the doctors to uh, ending at the fourth class worker. So every area, every person should have a protection against occupational health injuries. So every organization should look after the occupational safety. So when it has to look into prevention and protective measures in the hospital areas to minimize the occupational safety and health risk. What are the preventive and protective measures means? Nothing but so preventive and protective equipments, providing complete PPEs and providing hand hygiene things and respiratory hygiene things, etc., etc., and giving minimum things like masks, gloves, and keeping sanitizers everywhere, and disinfecting all the areas like wards, nurses stations, and bedside areas, and the surrounding hospital surroundings um, with the disinfectants. Okay, so this is the thing we have to do. Sodium with the sodium hypochlorite solution, we have to do the disinfection. Okay, and next point: provide information, instruction, and training on occupational safety and health. So one must have idea about the what we are going to know. So for this, management has to give the information by the uh, social media or mass media, or by the spreading, giving pamphlets, or conducting training classes, or okay, or giving instructions to the senior managers. Okay, like we have, they have to give all this information about the occupational safety measures. So what are all those? Refresher training on infection prevention and control, IPC. So uh, so hospital management has to give training on the infection prevention and control practices. So and what training we need to get, like use putting on, taking off, and disposal of personal protective equipment, and provide adequate IPC and PPE supplies. PPEs like mask, gloves, goggle, gowns, hand sanitizer, soap and water, cleaning supplies. Minimum things like management has to provide all these infection prevention control things, and PPE supplies like masks, gloves, gowns, hand sanitizer, all those things in sufficient quantity to those caring for suspected or confirmed COVID-19 patients also. So nowadays we have seen so many areas they are not giving good equipment to the people who are caring for the suspected cases. People, nurses or doctors who are working in the isolation areas, they are not getting proper PPE supplies. So it has to be supplied to the areas where nurses or doctors are working in isolation wards or quarantine areas also. So that is the thing. Yeah, next, familiarize personnel with the technical updates on COVID-19 and provide appropriate tools to assess, triage, test, and treat patients, and to share IPC information with the patients and public. So, all the employees should have familiarized with the technical updates on the COVID-19, and they have to provide appropriate tools to assess and triaging. I told you how to triage. Triaging is nothing but separation though, so and they must have a idea about the testing, how to get tested, and where to give samples, how to handle those samples, all those things to be given training, and how to treat the patients. So these things should be trained all the employees by the management, and provide appropriate security measures as needed for personal safety, and provide blame-free environment in which health workers can report on incidents such as exposure to blood or bodily fluids from the respiratory system or cases of violence, and adopt measures for immediate follow-up, including support to victims. So management, this is the main right of any employee, that management has to provide a blame-free environment. So if you get if you are working in COVID-19 positive area, so you should not be get blamed by the others. Or if you get a positive also, so we should not be blamed. So that assurance has to be provided by the management. So that blame-free environment has to provide by the management, and advise health workers on self-assessment, symptom reporting, and staying home when ill. So every organization, every management has to give assurance to the health workers on self-assessment and symptom reporting. If a person, if an employee, a nurse or a doctor, a physiotherapist, or whoever it may be, if a person has experiencing any symptoms like positive symptoms, if he is having any doubt, then he can report without any hesitation, and he can stay at home. So that confidence has to be provided by the organization, and maintain appropriate working hours with breaks. This is the one of the main thing we have to concentrate as a nurse, a doctor, and a therapist, or a lab technician, whoever it may be. When you are in a health team, you have to ask your right that management has to provide proper appropriate working hours with breaks. So when you are wearing a complete PPE, like from top to bottom coverage, so you will not get proper oxygen also. You will get suffocated inside that PPE. So because you will wear two gloves, two masks, one N95 surgical mask, and entire two gowns, so shoe covers, all those things. So you will not get proper oxygen. So you will get suffocated. If you are working with all these equipments for a continuous 6 hours or 10 hours or 12 hours, so definitely you will be in a trouble in a long run. So that's why what management has to think. So management has to give a appropriate working hours with the breaks. I have observed in so many hospitals, without even they are following any guidelines of the WHO or CDC, they are just treating nurses or doctors as a slaves. Means they are keeping nurses for 12 hours in a wards without any breaks, with a complete PPA. So that is a hectic situation. So this has to be cleared by the management, and consult with the health workers on occupational safety and health aspects of their work, and notify the labor inspectorate of case occupational disease. If you found anything, you can inform, and allow health workers to exercise the right to remove themselves from a work situation when they have reasonable justification to believe presence an imminent and serious danger to their life or health, and protect health workers exercising this right from any undue consequences, and not require health workers to return to a work situation where there has been a serious danger to life or health until any necessary remedial action has been taken. So, this is a right of any health worker, whether you are a doctor, a therapist, or a nurse. So, if you are not if you are not willing to come, I mean, if you are unwell, so if you are you are in a danger situation, so there is no point to return to work. So the management has to give assurance that you can stay at home until you will get relieved from those symptoms. Okay, this has to be provided, and honor the right to compensation, rehabilitation, and curative services for health workers infected with COVID-19 following exposure in workplace, considered as an occupational disease arising from occupational exposure. So this is also good thing. So when you are infected, when you are in a duty with the COVID-19, so hospitals or managements, organizations has to give some compensation or rehabilitation. And now recently Indian government has given announced some compensation for the healthcare workers. If you are getting COVID-19 positive when we are in working, so you will be benefited with 50 lakhs like that. So like that, every organization has to give, and provide access to mental health and counseling resources, and enable cooperation between management and health workers and their representatives. So these are the rights of the employee. So these rights has to rise are asked by the employee to the employer. So before rising an employee in any these type of issues, all the management has to fulfill these things. And what are the responsibilities and roles of a health worker? So we have to simply obey and follow the all the rights. If they are strictly maintaining or providing all those rights, then automatically we can fulfill our responsibilities, like follow established occupational safety and health procedures, avoid exposing others to health and safety risks, and participate in employer provided occupational safety and health training. So when organization is giving some training, you have to attend for that training, and you have to get the information, and use provided protocols to assess, triage, and treat patients with respect, compassion, and dignity. So this is the very everyone must have this type of quality. This is a good responsibility. Like you need to treat the patient with respect and compassion and dignity. Maintain a patient confidentiality. Confidentiality is the main thing. Nursing persons also has to maintain confidentiality. This is the best quality of a good nurse. So you should not reveal the one patient issues to the others, one patient disease condition to others, and you should not murmur, whisper, or do something illegal activities with that patient condition. So that is the main thing. So one must have maintained the patient confidentiality. So simply follow established public health reporting procedures of suspected and confirmed cases. Next, provide or reinforce accurate IPC and public health information, including to concerned people who have neither symptoms nor risk. Put on, use, take off, and disposal of PPE properly. So this is the very important point. All the healthcare workers must have idea about doping and donning of techniques. Doping and donning of techniques are very important. How to put on all the PPE, like from top to bottom, like from the head cap, then face mask, surgical mask or N95 mask, and face shield. Then coming to the how to wear gown, how to wear shoe covers, how to wear the gowns, so how to wear this gloves. So all these things you must have idea, and you need to learn. And each and every step whenever you are wearing, so after each and every step you have to do the hand rub. So and same thing, how to use after wearing all these things, how to use, how to treat the patient. That thing also you need to learn. and how to take off doping. Doping also very important, but most of the health workers are getting infected with this deadly disease by the doping, improper doping of techniques only. So if you don't know how to remove, take off these PPEs, then definitely you will get contaminated with the viruses. Then you will get infected. So one must know the doping and donning techniques. So next thing, self monitor for signs of illness and self isolate and report illness to managers if it occurs. Advise management if they are experience signs of undue stress or mental health challenges that require support to interventions with report to their immediate supervisors. Any situation which they have reasonable justification to believe presents an imminent and serious danger to life or health. So if anything, no need to hesitate. If you found anything, so immediately you need to inform to your immediate seniors or supervisors or HODs. Okay, this is the thing. And next, principles of IPC strategies associated with healthcare for suspected COVID-19 infection, prevention and control strategies. IPC is nothing but infection, prevention and control strategies. How to control, how to prevent these things means to achieve the highest level of effectiveness. To achieve the highest level of effectiveness in the response to COVID-19 outbreak using the strategies and practices recommended. IPC strategies to prevent limited transmission in healthcare setting, including the following. There are 4 things. First thing, ensuring triage, early recognition, and source control. So there are 4 things how to follow the IPC strategies. Like first thing, ensuring triage, early recognition, and source controlling. How to do the triaging and how to isolate, how to recognize early. So next thing, second point, applying standard precautions for all patients. Applying standard precautions for all patients and implementing empiric additional precautions means how to prevent droplet infection, droplet and contact, and whenever applicable, airborne precautions like aerosol generating procedures. And the fourth point, implementing administrative controls. And the next thing, using environmental and engineering controls. So one by one, I will just give you a brief idea about what are all the IPC strategies. Means infection prevention control strategies. By following all these 4 things, like ensuring triage and early recognition, source control. So how to do means, like by clinical triage includes a system for assessing all patients at admission. At the time of admission only, we can triage, allowing for early recognition of possible COVID-19 and immediate isolation of patients with a suspected disease in an area separate from other patients. So that is called source control, how to control. So, and to facilitate the early identification of cases of suspected COVID-19. So for that, what we have to do, how to ensure triaging, early recognition, source control means encourage healthcare workers to have a high level of clinical suspicion. So how to encourage healthcare workers means, as a nurse, as a physiotherapist, as a doctor, as a lab technician, so you have to think all the patients are supposed to be a positive. You need to treat each and every case as a positive case. So what is that? Encourage healthcare workers to have a high level of clinical suspicion. If you have a high level of clinical suspicion, if you're treating patient, each and every patient as a COVID-19 positive, then you will follow the proper infection control practices. Then only you will wear the proper PPEs. Then only you will not get infected. If you are not taking proper, if you are not suspecting that case as a positive, then you will not take it as a serious. So that is the one thing, how to identify the cases earlier. How you will identify means you need to suspect each and every case as a positive. And next thing you need to remember, as a healthcare worker, establish a well-equipped triage station at the entrance to the facilities. Okay, supported by the trained staff. So each and every organization has a well-equipped triage station at the entrance to the facility. So I mean, at the entrance of the hospital only, um, we need to have one triage station. So and there one staff should be there, and each and every staff has to do the screening. So these are the things coming under first point: ensuring triage, early recognition, and source control. So by following all these things, then you can do the triaging and early recognition. Triaging principles, I told you how you will do the triaging, or how you screen the patient's means. You need to ask the signs and symptoms of the case. Okay, and post those signs in public areas, reminding symptomatic patient to alert healthcare workers. Suppose when you are working in triage area, so you need to paste the posters and pamphlets there about the signs and symptoms of the COVID-19 positive case. So by seeing that the patient can experience and tell, so I'm having fever, dry cough, sore throat, diarrhea. So all those things they will tell, and we need to observe some signs, and we need to ask the symptoms. Then based on those signs and symptoms, and if they are having any travel history, all those things, then we can suspect that patient is having COVID. Then we can separate that patient from non-COVID to COVID. Then we can send that patient to the corona testing area, like a COVID casualty, COVID concern area. So this is about triaging. Next, coming to the second point, applying standard precautions for all patients. What are the standard precautions? Standard precautions include uh, hand hygiene and respiratory hygiene. These are the two things coming under standard precaution: hand hygiene and respiratory hygiene. So the use of appropriate personal protective equipment, like PPE, personal protective equipment, according to a risk assessment, injection safety practices, safe waste management, proper linens, environmental cleaning, and sterilization of patient care equipment. So if you are using a proper PPE according to the risk assessment, infection safety practices, safe waste management, proper linens, environmental cleaning, and sterilization of patient care equipment, then you are following a proper standard precautions. So based on the area, you have to use different types of PPE. Suppose when you are working in isolation ward, so there is only suspected cases will be there. So then there is you no need to wear complete PPE, like no need to wear double mask like N95 and surgical mask. If you wear N95, it is okay, and no need to wear complete all these things like two gowns and two gloves. At least with one layer you can adjust. And when you are dealing with, when you are working in a positive cases area, you have to follow the complete PPE techniques like double glass, double mask, double gowns, okay, shoe covers, and face shield, head cap. All those things you have to maintain. Okay, like that, you need to do the risk assessment first, and you have to, based on the risk assessment, you have to use some PPEs based on that. And injection safety practices also very major important thing for the nurses. Mostly treatment is given by the nurses only. When you are working in a clinical area anywhere, when you are giving injection, you have to follow some safe injection practices. Okay, so that gives you protection from the COVID-19. Because when you are going to give a injection, whether it is IM injection, IV injection, or when you are going to give a small syrup also, you have to wear PPE. Because when you are dealing with the patient, you are near to the patient. Without, there is no meter, there is no social distancing, there is no, not even 1 meter distance. So you will go close to the patient. whenever you are giving injections or treatment, anything, so you have to wear the PPE. Okay, you need to follow the standard precautions. Okay, otherwise you will be get infected. So if you are not wearing mask and gloves, without mask and gloves, you are touching and giving the treatment, then by chance at the time patient coughs, sneeze or speaks, then the droplets will come and mix in the air and die, or you will, if you inhale those droplets, then you will get infected. Or already coughed or sneezed, the already patient surface area is already infected, then without gloves and mask, means with the bare hands, if you touch the surroundings of the patient, then definitely you will get infected. So that's why you have to follow the injection safety precautions and safe waste management also. So so this is very important thing. When you are disposing the things, like discarding the things, biomedical waste management is very important. uh, so whenever you are disposing the things, it should be discarded properly. And all the PPEs, after using doping, you have to discard in the red bin only. In red bin only, all the PPE things you have to discard. And remaining all standard precautions only. I think no need to explain the biomedical waste management and segregation. So same wise, environmental cleaning, all those things you have to uh, look into this second point, applying standard precautions for all patients. This is coming under in the second patient. And one more thing, ensure that following respiratory hygiene measures, how to follow the respiratory hygiene measures. The most important thing, if you are suspecting any patient with COVID-19, what we have to do, you have to provide a mask to that patient. Okay, if you are wearing N95 and patient is not having any mask, he is continuously coughing, sneezing, then the droplets will come and travel in the air. So by chance, if you breathe in, then you will get infection. That's why what we have to do, we have to control the source. So for that, what we have to give one mask to the patient. Ensure that all the patients, if you are suspecting, all the patients are. That's why we are promoting use mask like that. So ensure that all the patients cover their nose and mouth with a tissue, at least a tissue or a elbow when coughing or sneezing. Okay. um, so when the patients are others also, when they are coughing or sneezing, they need to do what, how, with a flexed elbow they have to cough or sneeze, or always their mouth and nose should be covered with a mask, or if mask is not there, at least they should cover with the handkerchief or with a tissue. Okay, offer a medical mask. Okay, better. And perform hand hygiene after contact with respiratory secretions. Always after, we will have a standard WHO hand hygienic movements. I will show you in the end of the slide. There are 5 movements: before touching, after touching the bed patient, and before touching the any procedure, before doing any procedure, after doing procedure, and after touching the patient surfaces. In these 5 areas, definitely we have to follow the hand hygiene, and we have to ask the patients also do the hand hygiene. Okay, so these are the things we will see on the second point, applying standard precaution. These are the coming under standard precautions. Coming to the third point, implementing empiric additional precautions. So what are the empiric additional precautions means? How to control, means how to control, what are the precautions we have to take when we are working in particular in COVID positive or suspected areas. There are two things main. To get the infection, mainly 2 ways, either direct contact or by the droplet precaution, or by the droplets. Okay, if you touch, means how to contact, means if you touch the surfaces, then there is a chance of getting infection, or by the droplet also. Or next thing, by airborne precautions. Airborne things means how we will get the airborne infection? When we are doing any aerosol generating procedures. So for contact and droplet, what are all the precautions we have to take? So here, in addition to using standard precautions, all individuals, including family members, visitors, and healthcare workers, should use contact and droplet precautions before entering the room of suspected or confirmed cases also. Okay, patient should be placed in a adequately ventilated single rooms. This is a thing. Or if it is there is no single rooms available, then at least maintain a social distance. Then all patient beds should be placed at least 1 meter distance. That is a common. And where possible, team of healthcare workers should be designated or care exclusively for suspected confirmed cases to reduce risk of transmission. Healthcare workers should use a medical mask always. Okay, and we have to use all those things. I told you, all the face protection goggles and face shields to avoid contamination of mucous membranes. Then healthcare workers should wear clean, non-sterile, long-sleeved gowns, and should also use gloves, all those things, all boots, coveralls, aprons, all complete PPE. PPE coming under all those things. So these are all the, by following these techniques, you can prevent the contact and droplet infection. So by wearing complete PPE and doing hand hygiene, you can prevent the contact and droplet. I am explaining the third point. So droplet and contact things. So these are the precautions you have to take. And coming to the airborne generating precautions, so how to prevent the infection from the airborne? So when this airborne, you can say that when you are doing some procedures like aerosol generating procedures, some aerosol generating procedures like a tracheal intubation, when you are doing a intubation for a patient for providing a mechanical ventilation through the ET tube, endotracheal tube, or a tracheostomy. Okay, tracheal intubation, non-invasive ventilation (NIV), and tracheostomy, cardiopulmonary resuscitation when you are giving CPR. Okay, there is also chance of getting aerosol generating, and manual ventilation before intubation and bronchoscopy. So these are all the some of the aerosol generating procedures. Aerosol generating procedures, like I'm explaining one more time: tracheal intubation, NIVs, non-invasive ventilations, or tracheostomy, cardiopulmonary resuscitation, and manual ventilation. And bronchoscopy. These are the some of the aerosol generating procedures. When you are going to perform all these type of procedures, you have to wear complete PPE, face shields, goggles, all those things. Okay, and when you are doing the area should be well ventilated, adequately ventilated, and that all the rooms, all the ICUs, are where the patients you are keeping, that should have a negative ventilations, and so you have to use proper PPE things. Then only you can get prevent this COVID-19 from the aerosol generating procedures. And fourth point, implementing administrative controls. And so here, what we have to do, administrative controls and policies for the prevention and control of administration within the healthcare setting. So I told you all the rights. Those rights has to fulfill by the management, like training, educating all the staffs, and providing all the PPE things. This is the administrative controls. And administrative measures over. Then next, coming to the using environmental and encouraging controls. Here also, so we need to encourage the environment. So all means environments should be cleaned with the sodium hypochlorite. So it has to disinfected with sodium hypochlorite daily, and proper cleaning should be there on all the surfaces. These are the 5 points coming under the principles of IPC strategies. IPC means infection prevention control strategies. So in the infection prevention control strategies, we need to learn about the ensuring triage, early recognition, and source control. Then applying standard precautions for all patients, implementing empirical additional precautions like how to get what are all the precautions we had to take when droplet and contact, and coming to the aerosol generating procedures, implementing administrative controls using environmental and engineering controls. These are coming under the IPC strategies. Coming to the next, duration of contact and droplet precautions for a patient with COVID-19. Standard precautions should be applied at all times. Additional contact and droplet precautions should continue until the patient is asymptomatic. More comprehensive information about mode of virus transmission is required to define the duration of the additional precautions. And collecting and handling laboratory specimens from patients with suspected COVID-19. I told you in the my beginning slides how to collect, and mainly when you are collecting a samples, whether it is an nasopharyngeal sample or a oropharyngeal sample or a blood sample, so you have to take some precautions. All samples collected for a laboratory investigation should be regarded as a potentially infectious. So if, all the samples, you have to treat all the patient as a positives. So healthcare workers who collect, handle or transport clinical specimen should adhere rigorously to the following standard precautions. So whenever you are collecting, usually nurses will not do, mostly doctors and lab technicians are doing all these things. So whenever you are involving this in these techniques, when collecting samples and all, you have to follow some infection control practices, like ensure that all personnel who transport specimens are trained in safe handling practices and spill decontamination procedures, and place specimens for transport in leak-proof specimen bags. Okay, and ensure that laboratories in healthcare facilities adhere to appropriate biosafeties. So these are the things we have to follow when collecting and handling and transporting the samples of a COVID suspected cases. So everyone must follow all the IPC techniques, and it has to be carried in a closed containers, and after giving and before taking the samples also, you have to follow the respiratory hygiene and hand hygiene also. So coming to the management portion, medical management. The best way to prevent infection is to avoid being exposed to this coronavirus. The best way is hand hygiene. So first thing, we need to avoid expose. If it is not possible, when you are exposed, what you have to do, you have to do the hand hygiene. Hand hygiene is the best way to prevent from a COVID-19 infection. Wash hands often with soap and water for at least 20 seconds. If water and soap not available, use an alcohol-based sanitizer. Keep hands off your face. Avoid touching the eyes, nose, and mouth with unwashed hands. Sorry. So, perform hand hygiene. You should not touch the eyes, nose without washing hands. Maintain social distancing. I told you already, at least 3 feet. 1 meter distance. Who are sick, stay at home. Yeah. So next point, proper cough sneeze techniques. Cover your cough, sneeze with a tissue, then throw the tissue in the trash. So whenever you are coughing or sneezing, I told you, with a flexed elbow only you have to cough or sneeze. Don't use the arm or means palm to cover your face or nose when you are coughing or sneezing. Next coming, supportive care. People infected with COVID-19 should receive supportive care to help relieve from these symptoms. So as a nurse, you play a key role in giving supportive care. So we have to give the supportive care by giving a psychological support and moral support. And when you are treating the patient, you need to encourage the patients to come out early. Okay, and Next, coming to the severe cases. For severe cases, treatment should include care to support vital organ functions. So, for how to deal with severe cases means we need to deal with suppose if a patient is having multi-organ dysfunction or ARDS, so aggressive treatment should be given. So, all those things I will explain in a later. Next, pharmacological management. There is no specific antiviral medication that is recommended for COVID-19 infection. So no current vaccine to prevent it also. As of now, there is no vaccine. I think some countries are having trials for this vaccine, but I don't think it is a good success. And there is no specific antiviral medicine also. So only we are giving supportive treatment. I mean palliative treatment, symptomatic treatment only we are giving. We are just treating these symptoms and giving psychological support and keeping the patient in isolation areas and treating the other comorbidities. So by that only coronavirus is treating. So that is about pharmacological management. And coming to the main thing, nursing management. As a nurse, we have to focus on this thing. As a nurse, you must have a knowledge about the disease condition, okay, and mm, you have to understand the patient situation completely, and based on that we have to do some assessment. All the nurses must have idea about the nursing process, so we'll have a assessment, uh, means diagnosis, goal, planning, implementation, all those things. So based on that format only I will give you just brief idea how you assess. The assessment of a patient suspected of a COVID-19 should include what you need to ask, like I told you in the triaging area. So first of all, you need to focus on the travel history. So whether the patient is having any travel history, like recently in India, most of the um, Delhi, that Markaz cases only got when the people are having travel history of Markaz, Delhi, then they got all positives. So like that, we have to ask whether the patient is having any travel history from the positive areas. Uh, that is coming under assessment. Healthcare providers should obtain a detailed travel history for a patient being evaluated with fever and acute respiratory illness. Along with the travel history, we have to assess the patient's temperatures and acute respiratory illness also. And we need to do the physical examination properly. So patient who have fever, cough, and shortness of breath, and who has traveled to Wuhan, China, that is actually this is a previous point now. So it is spread all over the world. So we should not consider only for Wuhan, China. So as I told you already, if a person traveled from a Delhi or from anywhere, now cases are increased all over the India also. If a patient comes from Maharashtra, also we have to we have to suspect. So like that, we have to collect the assessment history. In the assessment, we have to assess the patient in the initial step only, the first contact of the patient. As a nurse at the triage center, you have to do the assessment of the patient. You have to ask the symptoms of the patient. So what symptoms you will see? Fever, dry cough, shortness of breath, and sore throat, then diarrhea, myalgia, any pains. So all this history you have to collect along with the travel history. So this is coming under assessment. Then coming to the then in the after assessment, you have to do the diagnose. As a nurse, you by using your knowledge, you have to frame one diagnosis. So after triaging, you will get one idea. Suppose if patient is complaining of fever, sore throat, dizziness, means diarrhea, all these symptoms and travel history. So then you will get idea. Okay, maybe you can suspect that patient is having COVID-19. If he is not reporting any of these symptoms, you can easily easily identify that he is not. You cannot suspect that patient is coming under a COVID category. So based on the assessment data, the major nursing diagnosis for patient with COVID-19 are, so main thing like infection. First of all, first point, first diagnosis is infection. infection related to failure to avoid pathogen secondary to exposure to COVID-19. So you will frame a nursing diagnosis as a infection related to failure to avoid pathogen secondary to exposure COVID-19. Next diagnosis, what you will frame: deficient knowledge related to unfamiliarity with disease transmission information. Maybe if the patient is illiterate, or if a patient is not having idea about the disease, that's why he might have infected. So that's why you can frame a nursing diagnosis as a deficient knowledge related to unfamiliarity with the disease transmission. So the next thing, if the patient is having high grade temperature, then you can frame a hyperthermia related to increase in metabolic rate. And next diagnosis, you can frame main thing: if the patient is developing a SOB, shortness of breath, or you can say dyspnea, then you can frame a diagnosis called impaired breathing pattern related to shortness of breath. Okay. And lastly, if you, after finding these symptoms, if you are suspecting that patient, definitely patient will have anxiety, or patient only having natural anxiety, then by this disease condition, then you can frame a diagnosis called anxiety related to unknown etiology of the disease. So patient, generally now in everywhere in the globe, people are having panic. People are panicked by this COVID-19. So that's why you can frame a diagnosis called anxiety related to unknown etiology of the disease. So these are the just examples of the nursing diagnosis. You can frame a infection related to failure to avoid pathogen, and deficient knowledge related to unfamiliarity with the disease transmission, and hyperthermia related to increase in metabolic rate, impaired breathing pattern related to shortness of breath, and anxiety related to unknown etiology of the disease. So these are the diagnosis. How you will diagnose means based on your assessment data. Next, coming to the nursing care planning and goal. How you will plan a goal? How you will, based on the diagnosis, you set a goals and you will plan how to relieve those symptoms. Means, okay. Then what is your goals? Prevent the spread of the infection. To prevent the infection, so you will plan some. You will have some plans. So that is your goal first for the first diagnosis. And next diagnosis, what is your goal? Learn more about the disease and its management. For the deficient knowledge, you can frame a diagnosis like learn more about disease and its management. And for the hyperthermia diagnosis, you can have a goal like improve body temperature levels. And for the fourth one, impaired breathing pattern related, as a nurse, you will have a goal. You need to restore breathing pattern back to normal. So, and for the anxiety, you will have a reduced anxiety. So these are your goals. As a nurse, you will assess the patient data. Okay, you will assess the patient, collect the data. Based on the assessment data, you will frame a diagnosis. After framing diagnosis, you will set some goals and priorities. So those goals are here. For the prevention, you have to prevent, and for the knowledge deficient, you will give some knowledge like this. These are the goals. Next, coming to the interventions. What is your plans? Interventions. What are you going to do for relieving all those problems? So you have set a goals. So you are going to implement it. You are going to do that things. So for that first one, monitor vital signs. As a nurse, I told you monitoring is very, very important. So you have to monitor the patient vital signs. So TPR, BP, and SpO2, saturation percentage of oxygen, is very, very important. So monitor vitals, monitor the patient temperature. The infection usually begins with the high temperature. Monitor the respiratory rate of the patient, as a shortness of breath is another common symptom. Okay. So you have to monitor the respiratory rate, temperature. Okay. These are the main things you have to monitor when you are TPR. When you are noting a TPR chart, temperature chart you have to maintain, and pulse you have to write each and every hour, and respiratory rate will be increased definitely. Usually you will have a 16 to 20 to 22. So if more than 24, so then you can note it. Why this respiratory rate will increase means because of the shortness of breath. So this is one of the symptom. So and one more vital, what you have to monitor O2 saturation. Monitor the patient O2 saturation because respiratory compromise result in hypoxia. So this is a very common symptom and a vital symptom in the COVID-19. You have to observe the saturation percentage of oxygen with the using the finger probe or by the connecting the monitor saturation probe also. So usually the saturation should be about 95 to 100 it has to be. So if the person O2 saturation is coming down less than 94 or 93, then you have to concentrate on the patient and maintain respiratory isolation. So this is also one of your intervention to prevent the spread of the infection. So how you will do the respiratory isolation? Keep tissues at the patient bedside. So I told you, if there is a chance, you provide the mask, or otherwise keep the tissues at the patient bedside. Dispose secretions properly. Why we need to keep the tissues means when they are coughing, sneezing, they need to cover their face. Okay, dispose the secretions properly. So we have to follow the standard precautions and instruct the patient to cover mouth when coughing, sneezing, use mask, advise those entering the room to wear mask as well place respiratory stickers on chart, linens and so on. So these like this you can maintain a respiratory isolation. These are some of the nursing interventions. And coming next intervention, enforce strict hand hygiene. Teach the patient and folks to wash hands after coughing, reduce the prevent transmission of the virus. I told you already, hand hygiene is very important to prevent the spread of the infection. And manage hyperthermia. So how to manage? We have to treat the patient to hyperthermia with providing a PCM infusion or by providing cold sponge or like this thing. Use appropriate therapy for elevated temperature or to maintain normothermia and reduce metabolic needs. Next, educate the patient and folks. So we need to educate the people also, patient attenders also. Provide information on disease transmission, diagnostic testing, disease process, complications and protection from the virus. So these are the nursing interventions. As a nurse, you have to do all these things after assessing, diagnosing, setting goals. So these are the intervention. These are your things you to do with the when you are dealing with the COVID case. So next, coming to the to prevent infection and slow transmission of COVID-19. So you have to do the following. Already all these points I have explained, but anyway I'm just read out. Wash your hands regularly with the soap and water. Clean them with the alcohol-based hand rub. Maintain at least 1 meter distance between you and people cough or sneeze. Avoid touching your face. Cover your mouth and nose when coughing or sneezing. Stay home if you feel unwell. Refrain from smoking and other activities that weaken the lungs. Practice physical distancing by avoiding unnecessary travel and staying away from large groups of people. If you are following all these techniques, then you can prevent the spread of the infection or a transmission of COVID-19 from a person to person. So these are the things. And at the end, the last, I told you so many times, hand wash, hand wash, hand wash. So these are the 7 steps of hand washing. So when you are doing a hand rub or a hand wash with a soap and water or with a alcohol based hand rub, you have to follow these 7 steps. Step 1, palm to palm. Next, second step, right palm over the left dorsum, left palm over the right dorsum, vice versa. Means we need to clean our back of hands. And next, interlacing between the fingers. Next, interlocking. The next, thumb rotation, and at the end, fingertips rotation and wrist rotation. These are the 7 steps we have to follow when we are doing a hand wash or hand rub also. So these I hope you all follow these hand washing techniques. And next, 5 movements of hand hygiene. I told you in the IPC strategies. Whenever you are going to touch a patient, so always when to do hand wash or hand rub. So there are 5 movements. So before the first point, before touching a patient, whenever you're going to touch a patient, you have to do at least hand rub. Okay. Then before clean or aseptic procedures, before any procedure, okay, you have to do the hand wash or hand hygiene, hand rub. And third step, when we have to do after body fluid exposure. Okay, after exposing to the any type of body fluids, whether it is a respiratory fluid or it is a urinary fluid or it is a gastrointestinal fluid, whatever, whether it is a sweat, any fluid, after exposing to the any body fluid exposure, you have to do the hand wash or hand rub. Next, after touching a patient, so after touching each and every time, after touching the patient, you have to do the hand wash or hand rub. Okay. Then at last, after touching the patient surroundings also. So these are the 5 movements you have to follow. You follow the hand hygiene. So these are the things you have to follow. These are the things. So hope you guys you have understood something about my presentation. So thank you.
Thank you very much, Mr. Alexander. Such a very informative and very detailing session. I am sure that all participants and students are benefited. Yeah, I am inviting to Dr. Mehul Contractor. Please give your words to Mr. Alexander. Such a nice session.
Thank you so much, sir. Prakash sir.
Alex, it was wonderful session. You have taken the nursing level to a next different level. You know, starting from basics, what is COVID-19 and what are the current statistics and how we should look forward, and then basic sign symptoms that you have explained, then assessment. Okay, then what all things, precaution, do's and don'ts, the way you have explained is extraordinary. You have gone in depth. Okay, I would
Thank
say
you.
that even, a few of the things that I was wondering that, yes, I should think of this. I should do that. I should do this. I should implement certain techniques when my college starts. So I should implement those techniques in my college when, the students are coming, faculties are coming, they need to maintain the social distancing, then hand washing, rubbing, and maintaining the hygiene and all. Then the assessment part was quite impressive. Like nursing assessment also is in a different way, to maintain, the statistical parameters like vital signs, temperatures, look after breathlessness, hypoxic injury, any inflammations or any fever kind of stuff, which makes you to think over that what should be done at that point of time. So, in a nutshell, you have explained so well, and the student, all the viewers, they must have gone through all the details. And I would like to see the recording is there with me, not an issue. But actually,
Okay.
I would like to request you that please send me this PPT. Okay,
Sure.
I would like to circulate this to the all the viewers and all the students and the participants. Okay, so that they get to know, because this is actually really in a need right now, that the one should know, especially with the nursing management, the one should know if they are going to the hospital setup. For example, my final year students or any of the BSc student who is in fourth year, or any MSc students who is in the second year MSc right now, and they are about to get passed and then going to the hospital setup for a job, they must know in this pandemic situation, in this communicable disease situation, how they should manage the proper handling of the patient suffering from COVID-19. So I was literally amazed the way you have presented in depth, in depth. You didn't leave a single point out of that. Okay, so I was really happy that you presented in a such a way that appreciable, and keep doing good work. And thank you for accepting my invitation, and you have enlightened all the viewers, all the listeners, and all over the globe who is listening right now online on the Facebook. Friends, please follow the guidelines what Mr. Alexander has been, recently he has been explained. He is currently working in government hospital ESI. He is handling the cases currently, so he has vast knowledge how to deal with such COVID-19 patient. So please follow the instruction what he has given. Thank you, Alex. Thank you very much for enlightening our student with your knowledge. Thank you very much.
And finally, thank you so much, uh, my dear best friend and my brother, Dr. Mehul. And it's a very good opportunity for me to share my views on COVID-19. And last but not least, I must thank all the management of the VN Patel Medical Campus, Prakash sir, CEO sir, and Divyesh sir, and of course, my dear brother, Dr. Mehul. So I must thank all of these people to give me this opportunity to share my views. And I hope we might have faced some problem in the starting. So anyway, in future, if you have a good opportunities again, definitely we will have a good presentation. And hope all the audience have followed the things properly. If you have any doubts, please put your comments in the comment box, and I would like to share my level of best of my knowledge. So please share your views and comments. If any negatives, also please post in the comment box, so I will rectify in the future. And finally, this is the end of the session, and thank you so much.
Okay. And Divya, you can ask right now any of the students if they want to ask something, if they want to know something, if they are having any sort of cases in their areas, what to do, how to manage, how to educate that person, or being the paramedic student, if they are going in the medical field, what all things they further should look after. Because see, this the experts are saying that 1 year or 2 years this disease is not going to get the antidotes. So we have to live with the facts in our country.
Yes.
We have to live with certain facts. So how to do that? If any students is having any sort of queries or problems or anything that you would like to share with Mr. Alexander, our speaker of the day, please share healthily, okay, so that you get to look. See, this is for you people, okay, this is for you people, so please share. So Divya sir, please ask the student and get to know if is there any queries, if there any doubts or the questions or the thoughts that they want to share, please.
Yes, sir. Any attendees or if any student have any query, please ask in the chat box right now. If any query. Every attendance or every student, please ask the question if any query.
Yes, I think the session was quite smooth, easygoing, and step by step. So they understood the definition, introduction, the clinical features, the presentations of COVID-19, how it occurs, statistical research was there. Okay, that 11 and a half day, within that day, the symptoms are arising. Statistics says that, the research says that. So everything was quite normal. So I think all students must have got everything, then assessment part, then treatment part, investigation part, how to take the samples and all. So, in a nutshell, almost 360-degree of exposure is being given, right?
Actually,
In my point of view, it is.
Actually, we are lack of time. That's why I didn't concentrate on much about the treatment modalities and all. So, as a nursing point of view, I just covered it.
We understand
briefly.
your right now. You have very busy schedule during this COVID-19. Yeah.
Yes.
Okay, then we'll complete the session. Thank you very much, Mr. Alexander, for sparing the time with us and enlightening our student with the knowledge. And all the best to all the viewers, okay, and all the listeners all around the world. Thank you.
Bye, everyone. Okay.
Once again, I would like to thank you, Mr. Prakash sir, and Divyesh sir, and Mehul sir. Thank you so much, sir.
Thanks.